are our greatest weapon of all.
First step in solving any problem is recognizing there is one.
It's time we started fresh. Pain isn't something we thought.
All we can ever do for our heroes is remember them, and they gave up two lives, the one they were living and the one they would have lived. They gave up everything for our country, for us. They pray for freedom and justice.
Some veterans not getting the timely care that they need. Less than 1% of Americans serving in uniform. Good news is that in recent years we've made historic investments to boost the VA budget.
What is it? Why should we care?
We should care about press freedom
because we were informed.
In democratic societies, free, diverse, and pluralist media enable public debates and are essential checks
You don't
on
look
power.
satisfied. Let's discuss.
Hey guys,
What's going on?
new episode, TBI, big topic. TBI has been called a signature injury of Operation Enduring Freedom or Operation Iraqi Freedom, or as you know, OEF or IF, and 33% of all patients with combat-related injuries and 60% of the patients with blast-related injuries normally sustained TBI. And mild TBI concussion is one of the most common forms of combat-related injury. And based off self-report data, approximately 50% of troops engaged in active combat in Afghanistan and Iraq may have suffered a mild TBI. And even more, we got even more of those statistics later when people get out.
Yeah.
So statistics show that TBI is an important public health problem, and these numbers can help establish TBI prevention strategies, identify research and education priorities, and support the need for service among those living with the TBI. And according to Center for Disease Control, CDC, each year an estimated 1.7 million people in the United States sustain a TBI, so not only veterans. Of them, 52,000 die, 275,000 hospitalized, and 1.4 million, or nearly 80%, are treated and released from an emergency department. So you see about 75% of TBIs that occur each year are concussions or other forms of mild TBI, and those numbers are pretty high. So let's jump into the main topic, podcast.
Yeah. A new regulation for brain injuries. Because the Department of Veterans Affairs has been criticized for underestimating the effects of TBI and not awarding benefits to many veterans suffering from TBI, the VA has proposed a revision of Regulation 38 CFR 3.310 to help more veterans of TBI to qualify for benefits. The proposed rule recognizes 5 illnesses as being caused or worsened by TBI. A veteran who can establish service connection for TBI, that is, that the TBI resulted from military service, may be able to get an increase in benefits based on these illnesses once the new rule is finalized. So the Department of Defense and the Department of Veterans Affairs in May 2007, by consensus, have defined TBI as a traumatically induced structural injury and or physiological disruption of brain function as a result of an external force that is indicated by new onset or worsening of at least one of the following clinical signs immediately following the event. Number 1, any period of loss of or decreased level of consciousness. So a little bit of a concussion, getting knocked out. Any loss of memory for the events immediately before or after the injury. 3, any alteration in mental state at the time of the injury, confusion, disorientation, things like that. 4, neurological defects, weakness, balance disturbance, a little bit of like your leg being a little paralyzed, things like that, changing your vision. And 5, intracranial lesions, so you're talking about bruising your brain.
Forces causing brain injury include the head being struck by an object, The head striking an object, the brain undergoing an deceleration movement without direct external trauma to the head, a foreign body penetrating the brain, forces generated from events such as a blast or explosion, or any other forces.
Open versus closed TBI. A TBI resulting from something passing through the skull into the brain, such as a bullet or fragments from an explosion, is called a penetrating or open head injury. A TBI that results from either an object hitting the head or from the head hitting something forcefully, such as a dashboard of a car, is referred to as a non-penetrating or closed head injury.
Yep. So some of the symptoms that you might experience if you have TBI, or let's say you don't know that you're having TBI, so you might have a physical headache, nausea, vomiting, dizziness, blurred vision, sleep disturbance, weakness, sensory loss, some balance disorders, seizures, and so on. Besides physical, you can have cognitive disorders like difficulties or impairments in attention, concentration. You can't learn, memory, speed of mental processing, planning, reasoning, judgment, self-awareness. Your language may be slow, a little bit too fast sometimes. You might have issues with abstract thinking. And also a big one is emotional or behavioral. So that results into issues like depression, anxiety, agitation, irritability, being impulsive, being aggressive, and so on.
And causes of TBI. In the civilian sector, most common means of sustaining a TBI is through falls. Data from the CDC indicate falls account for about 28% of all reported TBIs. Following falls are motor vehicle related incidents. These include all incidents involving motor vehicles, bicycles, pedestrians, recreational vehicles, things like that. Firearm use is the leading cause of death related to TBI. Blast in combination with other mechanisms are a leading cause of TBI for active duty military personnel and war zones.
Yep. So what criteria defines a TBI?
A TBI occurs when any of the following happen after a traumatic event. Any loss of memory for events immediately before or after that injury. Any alteration in mental state at the time of injury, being confused, disoriented, slow thinking. Neurological defects, especially like weakness, balance disturbances, change in vision, and intracranial lesions. So you're talking about getting a little bruise on your brain. The severity of brain injury and the severity of TBI is determined at the time of injury. Though severity levels have prognostic value, it does not necessarily predict the patient's likelihood of functional recovery. Severity of TBI is a continuum, and the practical classification used to designate a patient as having mild, moderate, or severe injury is somewhat arbitrary. The severity grades, mild, moderate, and severe, are denoted by using one of the four examples. Indexes. The Glasgow Coma Scale, the GCS, the length of coma, duration of unconsciousness, length of period of altered consciousness or mental status, and length of post-traumatic amnesia, or PTA. The Glasgow Coma Scale, the GCS is a 15-point scale based upon rating of the patient's best eye-opening motor and verbal responses following an injury. Distribution of hospitalized trauma patients diagnosed with TBI based on GCS severity has generally been found to have a ratio of mild to moderate to severe of 8:1:1. While the GCS is recognized as a reliable measurement tool, it is other factors unrelated to the TBI itself, such as intoxication, intubation, and other injuries, and the length of time between the injury and measurement the GCS is not particularly useful in assessment for mild TBI concussions.
Yeah, VA doesn't use straightly GCS, but it's a starting point where you start actually. Because every year they develop a new questionnaire or new DBQ forms, but all those DBQs forms would include more or less those GCS 15-point scale rating in this or that form of questions. So they would include how are your motor responses, how you listen to commands, how you perform what you say, like how you actually behave, more or less. And TBI range as from like low, mild, like small concussion up to a severe one. And of course, based on those DBQ forms that VA has, they would determine like where you're at. You should also look at diagnostic code 8045, and that is a code that discusses in detail 3 main areas of dysfunctions that you may have. So as we said, it's going to be cognitive impairments, some emotional impairments, dysfunction, and physical dysfunction. So you would look at what you have with those that are in regulation and see where you're at, how you match. So what are the signs that you have been screwed during your exam? So what can it be?
So the ones that I look at, for me personally, some warning flags that help you know if you got screwed with the denial or you think that you deserved a higher rating, and you got it like a 0 or 10 for TBI, which I personally believe is incredibly low. So 1, were you exposed to a blast? It doesn't have to be a war blast. It could be a blast that you were in the motor pool or something like that. But if you're around a blast and you got hit pretty good, there's a safe bet. If your GCS score was under 13, you might have moderate TBI. If you cannot remember the incident beyond 24 hours post the TBI, 10% is a little low. If your behavior was altered for some time post TBI, unusual urinating in your sleep, sleepwalking, anger issues, look into it because it's probably a little more heavier than what that 10%, that 0 is trying to say. If you were unconscious for longer than 30 minutes or the amount of time is not truly verifiable, you might have a shot. And especially if you're deployed, I don't know who's counting. If you have some kind of brain scarring from an MRI scan or a CT scan, but the VA said it was MS or Lyme disease, you might want to look into it as more likely TBI because Lyme disease is not very big around here. Especially if you're a deployed veteran, I would assume more TBI than Lyme disease. If you have a memory problem, have positive neuropsychological screening, you know, the evidence from the doctor saying it, and the doctor blamed it on alcohol, it might be your TBI issue, and it might be your behavioral changes that's people thinking it's drinking when it's really not. If you have a lot of subjective symptoms only with the 0 or 10% rating. So the major thing to me personally is if the VA ever gives you a 0, they can't make it any lower, so fight them for it. If it's a 10% rating, then you might want to check on the severity and how it's going. But when you see 10% for TBI, considering what you had to do to get it, I think it's a little low. So you might want to check and make sure that it's an accurate rating because there's a good shot you could probably get an increase on that.
Yeah, those are like general things to look for, but it's not completely, so there might be much more.
Yeah, and if you're one of the guys that has TBI while watching this, your best bet's probably writing this down and watching it again.
Yeah. Know that a moderate TBI with residuals could be rated at 70%. Mild TBI with residuals and objective evidence can be something between 40 to 70%. So, and it is important to note VA's level of severity measure, which could vary depending on the point of view of the medical examiner. Like a 3 will warrant a 70% rating, but let's say you got 10. So look at those facts as well.
Yeah.
Also, the fact that VA with its TBI and with understanding on TBI and all VA policies, most of the time they a little bit different from what modern science looks at, how modern science views TBI. So you might use those, I don't know, those studies or those articles as well, as long as you're a private doctor.
Yeah.
So VA gives a ton of TBA evaluations every day. So, and of course, with all those tons of evaluations, there might be mistakes. But before your TBA evaluation, make sure that you are armed with facts. It's what TBI is and how to deal with that. I guess that's why you're watching this podcast.
Yeah. And so some of them is what their responses for when it comes to TBI. The TBI Disability Benefits Questionnaire is for internal use only. VA and CNP for TBI training videos for TBI with residuals. VA CNP TBI final examination. The demo for the VA for the CNP TBI examination training course. The demo for the VA CNP TBI examination 1, 2, and 3. VHA TBI independent study course. VHA and DoD management of TBI clinical and practice guidelines. The full Excel list of VA certified TBI examiners. The revised TBI fact sheet, and the VHA Directive 1603.
Yeah, those things that might help you in seeing what TBI is, so you can see all the links on the screen.
Yeah, and if you got evaluated and say they denied your claim or you got a 0 or 10 and it wasn't from a certified TBI examiner, you probably have a good shot at getting an increase.
Yep, and as always, you should always look at, like before you go to CNP exam, a DBQ questionnaire, so at least you'll know what they're going to ask you when you get there.
Yeah.
So first question would be as a diagnosis, so if you ever had any event or something that would qualify you for TBI compensation. So of course, if not, then you don't need to go to step 2.
Yeah.
And of course, you say yes, and then something happens. So they look at your medical history. They assess those 3 things: your mental, your physical functions, and your behavioral functions as well. So you'll be asked about your memory, attention, concentration, executive functions, what do you have and what you have not. What are your judgments? So normal, mildly impaired, moderately impaired, social interactions, orientations, and you'll figure out later then no matter to what doctor you go, they still you evaluate for those factors. How is your speech, I don't know, oriented in space, time, and person. So you always see those things. That's what they that's actually what they evaluating. Your motor activity, how you move, where you got pain, who you look at, the way you look at, your like visual spatial orientation, because sometimes you can space out. Some subjective symptoms, neuro behavioral effects, and how like what your speech looks like, communicational skills. Somehow they would try to evaluate your consciousness. And of course, some residuals like motor functional, sensory functions, hearing loss, visual impairment, seizures, like endocrine dysfunction, skin disorders. So all those things you'll find in that DBQ questionnaire. So familiarize yourself with that, and it will help you to be prepared for CNP exam. And of course, what Joe said, those VA TBI videos are very helpful as well.
Yeah, know what you're getting into so you have better odds.
Yep. And as everybody else, VA and examiners got to go through the training, through TBI training, and at least you'll know like what they trained for.
Yeah.
Yep.
So take advantage of it.
Yep. So just for your heads up, like severity for TBI can be measured not only by those factors, but the first one would be time. How, like, if you knocked yourself out, how long you've been unconsciousness. So up to 30 minutes, I would say normally it's normal TBI, what they call.
Yeah, normal for veterans.
For veterans, like moderate would be something in between like 30 minutes to the whole day, to 24 hours. And severe would be, I guess, coma.
Pretty much, yeah. After 24 hours, yeah.
Yeah, so that's pretty much what you're looking at. So look at the time first and all those factors that affect you. Have anything else?
No, definitely when it comes to TBI, you guys should probably review this a few times and review the study videos that the VA uses so you have a good idea where they're coming from. Review the DBQ forms. When it comes to good movies, good TV, tomorrow F is for Family is coming out on Netflix with Bill Burr's cartoon, and you guys should really watch that. It's pretty funny.
Yeah, or Hacksaw Ridge.
Oh yeah.
Good movie. Liked it a lot. And of course, I like all the movies from Mel Gibson. So that's fun. It's not an exception. And words of wisdom of the day.
Once you have them by the balls, their hearts and minds will follow.
Right, Lyndon B. Johnson. That's it, folks. Thanks for listening. Until next time, over and out.